the industry for 26 years now. I spent 15 years in big pharma, working in early development, and so that quite a few years ago now. And during that time period, clinical kind of managed everything. We did all the components, and so actually really began my exposure to trial master files back then, believe it or not, in setting up TMFs and understanding that the TMF was kind of more than just those essential documents and trying to pull all that content together. We also managed our own inspections, so it really was to our advantage to have a well-organized TMF even back then. I spent the last 11 years with Just-in-Time GC. We work with small, mid-sized pharma companies and CROs, and we really work in helping them operate in a regulatory compliant manner. So the big focus there is obviously TMF, because a good, solid, regulatory compliant TMF will really, quite frankly, get you through a regulatory inspection. And so TMF is kind of a large part of what we work with. I've been a member of the TMF Reference Model Working Group for the last several years, and I've led the Zone 4 revisions to version 3 of the reference model, and I participated actually in several of the other work zone revisions. And then I've also been involved in a couple of the working groups that the reference model has set up. Just maybe by a show, green check marks, how many of you are familiar with the reference model and have actually worked with it?
I've been working with it.
Okay, great. All right, great. So you will have some exposure to I will spend a little bit of time on it, but I won't dwell on it since you've got some experience with it. Our learning objectives today are to talk about the responsibility of the sponsor and the CRO in TMF management, because both organizations have responsibility. A sponsor cannot turn over their TMF to the CRO and just walk away from it. As Michelle mentioned, it really is something that the sponsor has responsibility for. And we want to talk about understanding those critical components to the TMF study map. That's a really valuable tool in your partnership with the CRO, because everybody agrees on what content is held. We're also going to talk about the components of the TMF plan and how you can use that TMF plan to really ensure TMF quality. Let's start with the definition of a TMF, because I think that puts us all on the same playing field. The TMF is a standalone set of documentation, and it does not, nor should it, require additional explanation from the associated sponsor or site staff. So what that means is your TMF really should be able to stand independent of you and your organization. So an inspector or an auditor should be able to look through the TMF and really understood how the trial was managed, what happened with the study. Because your TMF is really all that documentation that demonstrates that you conducted your study in compliance with GCP, that the data of high integrity, and that the study was conducted in alliance to the protocol. And so if you think about it, having said all that, that pretty much encompasses all the content that actually goes into the TMF. It tells the story of what happened during the study. It actually is your story. It has a beginning, it has a middle, and it has an end. And all of that story from the startup all the way to database lock through to finalization and CSR, that whole story is what we put into the TMF. So it's the output, if you will, from all the different functional areas that are involved in the study. Now, it gets a little convoluted when you have multiple CROs or you have multiple organizations that are taking responsibility for multiple parts of the study, especially when you have small sponsor organizations or small CROs where maybe the sponsor is doing the ClinOps part of it, but a lot of the other functional area responsibilities are going to different vendors to manage. And so we really need to have an understanding about how do we get all that content together into one location. So what's the purpose of our TMF? Well, our TMF is really a record that shows that we were compliant with good clinical practice. It shows we're compliant with our SOPs, and those SOPs are important, number one, to the investigator, number two, to the sponsor, and number three, to the monitor or the CRO that's involved in the study. So it's really critical that we keep all of that in mind, that you have to be compliant with those three areas. It gives the regulatory authority documentation to the validity of your data. And I had a great question from an attendee from another session saying to me, my TMF is what's part 11, when you say Part 11 compliant, and what the regulatory agencies are really interested in is my data, right? So my data is what's important, and I focus on my data. My TMF kind of just supports that. But what I think we lose sight on is that our TMF is data too. And whilst we don't submit it as part of our database or part of our data analysis, it's still the data on which the agency makes a decision as to whether to approve our drug or not. Because you can have this crystal clear, perfect data that answers all your research questions, does and meets all your primary and secondary endpoints, but if you can't substantiate that you actually collected that data according to the protocol and according to the study plans, then you don't really have an approvable drug.